I just want to say that Senator John Erpenbach was devastated not to be able to be here. John Erpenbach was devastated not to be able to be here. He has a budget vote on the full 2-year budget tonight, so he sends along his regrets. He wanted to say that he wants to thank all the advocates that worked on this. We have a coalition of 38 groups in the Big Tent Coalition that worked on this. He specifically singled out David Newby, wanted to pass on his regards to what you did in this whole process of developing Healthy Wisconsin. But he also had advice he wanted to pass along. He says to finally get Healthy Wisconsin done after it was about the elections and about the whole process, they locked everyone in a room and they didn't leave until they got a plan. And so he recommends that this be done at the national level in order to get a plan at least as good. And so that's what he wanted to leave everyone with, even though he couldn't be here tonight. So thank you very much, everyone. I want to let David Newby say something as well, who's been doing this for over 25 years, and it's just unbelievable work on healthcare reform throughout his career, president of the AFL-CIO.
Thank you very much, Robert. Let me first thank the Progressive States Network for all the wonderful work that you have done in 4 short years on all of the issues, not just healthcare. And we look forward in Wisconsin, and I'm certain other states, to continue to work with you and also to thank you for your terrific work. In fact, it was the network that really got the work that we were doing in Wisconsin out nationally so that other people could understand what we were trying to do and hopefully to learn from it. Robert mentioned that we locked people into a room for about 4 or 5 months to come up with a bill. Situation was that when the Democrats took a majority in the state Senate, there were 3 universal health care bills that had been introduced in the legislature the previous session. And the leaders of the Senate Democrats wanted to propose and to pass a universal health care bill. They came to the leaders of each of the 3 bills and said, okay, different ones of us like different proposals. Under John Erpenbach's leadership, we want you to come up with a single bill that we can all support and pass. And I must mention that David Reamer, who was former budget director for Governor Jim Doyle in Wisconsin, was also a major player in developing Healthy Wisconsin, which was the ultimate product of these very difficult negotiations. We were all friends, we all know each other, we were all on the same track, but merging 3 plans together is not simple. I wish I could say that Healthy Wisconsin had been passed not only by the state Senate, but by the Assembly and signed by the governor, so that Wisconsin could have absolutely led the way in terms of guaranteeing the very best, high-quality, affordable, state-of-the-art medical care for everybody in our state and ultimately for the country, which is why we are all here tonight. But again, thank you to the network for all of your work. We continue to thank you and to look forward to further collaboration. Thank you very much.